Program Policy Appeals Committee of the Board of Health come to an order. I'm going to request our chairman to lead us the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Roll call, please.
Commissioner Matthew,
I am here.
Commissioner Baker,
Yep.
and Commissioner Leininger.
Yes, ma'am.
Thank you.
Next is approval of the agenda. You had the opportunity to look at any addition, deletion.
Move to approve the agenda as presented. Second.
Thank you. Commissioner Leininger made the motion and Commissioner Baker seconded it. Those in favor, please say aye.
Aye.
Those opposed say no. The ayes have it. The motion carried. We have an agenda. Next is public comment. Anybody on the line, please?
No.
Next is new business, Area Agency on Aging Advisory Committee appointments. I'm going to request Director Sawyer to speak.
Sure. Good morning. We included an email correspondence for your review, as well as a new applicant or an interested citizen from St. Joseph County for appointment and your consideration today. Joanna Adams is the Adult Services Supervisor in St. Joseph County and thought she would be a bit more engaged or likely to be engaged in that committee. And since our last meeting, has since said, you know what, I would really like it if you could remove me from formally being appointed and have our other adult services staff person appointed. So Sandra Leslie is the other adult services staff, like the field staff. So between she and the other adult services worker will share the responsibility of meeting attendance and then have voting privileges, etc. Which there's really not a ton to vote on in that committee. It's more discussion and input for planning purposes. So for your consideration, it's to remove Joanna formally and appoint Ms. Sandra Leslie to the advisory committee.
Commissioner.
We're not putting Madeline Wergu in there too?
She is already on the committee,
Okay.
sir. Mm-hmm.
I would move to accept or move to forward to the full board the recommendation to accept the resignation of Joanne Adams and the appointment of Sandra Leslie to the advisory council for the Area Agency on Aging.
Second.
We have a motion and we have a second. Discussion, please. I have a comment. I pray that you will invite Miss Leslie to come and sing before us. She says, I like meeting new people, meet us, learning about other agencies and resources. Then she say her interests are singing. So that would be good for our picnic or things like that.
I'll see what I can do.
Okay, I see she's not in that age group that we're really.
She might be. I don't know. We don't ask for birth dates when.
Well, it wasn't indicated on her interest form here, if she was 60 or greater.
So I would assume, well, sometimes people can fit both categories, you know, if they're still working and
Then they don't check both boxes.
Correct,
Right.
correct. So, and she's worked for DHHS for close to my entire career, if not my entire career, which is will be 25 years. So she could be. So
I'm 2 months, I'll 6 weeks, all done. I'm an insurance agent for 25 years, and I'm not close to that.
Isn't it odd?
I'm not close to
think-
that age yet.
Yeah, I'm not either, but
We need to take a roll call vote. No. Those in favor, please say aye.
Aye.
Aye. Those opposed say no. The ayes have it. The motion carried. Thank you so much. Next is very, very important, statewide anyway. Accreditation report. I'm going to request we are happy to see our health officer, Ms. Burns, here. And we thank you for having here today.
Glad to be here. So I'm going to direct your attention to the television screens. The Cycle 8 tool, I pulled this up so that you could see that this material is actually available to everyone on the web. The Michigan Local Public Health Accreditation Program publishes their cycle tools, and the user's guide for us, checklists, expectations. So the programs that were reviewed during the accreditation visits are included in this list. So for administrative capacity, we have powers and duties, quality improvement section, and the local plan of organization. You'll remember that we brought the local plan of organization to one of the board meetings for your review and adoption, maybe February meeting, maybe January, but not too long ago. That was a necessary piece of our accreditation project. Then we have programs that are part of accreditation in Michigan, which include food service, general communicable disease, hearing, immunization, on-site wastewater, HIV, AIDS, and STIs, vision. Those are all the core ELPHS, or Essential Local Public Health Services programs in Michigan that every local health department in Michigan is required to conduct. So those all have accreditation reviews. And then there are 3 categorical services that some health departments do, some don't. For us, we do section 10 and 11, WIC, and Children's Special Health Care Services. So CSHCS was reviewed. WIC is actually reviewed every 2 years. Accreditation is on an every 3-year cycle. So our WIC review was off. It was a year ago. So we did our WIC review last year. They were not reviewed during this accreditation cycle. They'll be reviewed in 2 more years, which will put them back on the same cycle as the accreditation. So it falls off like that routinely. So those are the programs that were reviewed. This particular cycle follows cycle 7, which was interrupted by the pandemic. So the last few local health departments were actually never reviewed during cycle 7 due to pandemic response. The decision was made to not go back and try to finish cycle 7, but to just restart with cycle 8. But cycle 8 was different in that it was a technical assistance review. So they didn't come to necessarily provide ratings of met, not met, and met with conditions. They came to identify areas where local health departments need assistance, and then reach out to that local health department to provide or work out when those particular needs can be met by the state offices. So as you look through the printed report, you will note that there are comments by the accreditors, the people that come and do the reviews. A lot of the accredit reviews are really technical assistance related in that this was identified and this is a recommendation. basically to get us ready for our next cycle, cycle 9 in 3 more years. Because we're really early in the cycle, we're the second health department that gets reviewed out of all 44. The accreditors were still trying to understand their role in some cases. So we expected, or I expected, that they would come and do a fairly normal review like they would do every 3 years and help identify for staff where we're going wrong, and then provide us with the tools and the training to get us back on track so that in 3 years we're ready to go. Not all program accreditors came with that mindset. So some of our programs, they showed up and how are you guys doing? What do you need? But they didn't review a document. In fact, my staff in some cases said, well, hey, we've got this stuff and we'd like to show you. And they're like, no, that's okay. We don't need to see it. So I communicated back to the folks at MDHHS and MPHI to let them know that that was really not helpful. You know, our staff took time to try to prepare, to take time away from their normal work schedule, to have these meetings and conversations with these accreditors, and they really didn't get much out of it in some cases. Then we had programs that came down like on-site wastewater, and they did exactly what I expected. And they did a great job, they gave us great feedback, they provided great recommendations. So being early in the cycle can be a detriment for 3 years from now, but it is what it is. Yeah. So what you see in the reports are the best information that's available from them. What I'm asking, and this got interrupted too, but what I'm asking staff is to go through these MPRs for each program and write out those that need to be addressed and how they're going to address it and the date by which it will be addressed. So like a work plan for those particular items, so that this doesn't just get put on a shelf and forgotten about until about 2 years from now, when the panic level starts to rise again, knowing that accreditation is on the horizon. And I think we'll all do better here at Branch Hillsdale St. Joe if, you know, we continually review what the MPRs are, continually evaluate how we're doing on those, and then we don't need to be panicked as that 3-year mark comes up. So that was really what I wanted to talk about with you. Do you guys have any questions about the reports?
Why is some of it in blue?
Yours is the only one. Unless yours is, 'cause mine's all black. I seen the blue on the back of yours, and I'm going through mine
Page
going,
9 and 10.
yeah,
I think those
Oh,
are
12 is on mine.
their comments, that's how I understood it.
No, I mean, no, because there's stuff like that spread throughout.
Well, it copied and pasted right as the reviewer put it in. So each one of these programs have different reviewers, and that reviewer sends their report, which collectively made this. So those reviewers wanted
Might
their
use a blue
comments to
Stand out,
more. Specifically, those are,
powers and duties.
yeah, well, it's the QI, so it's Jeanette, MPHI.
If I may add to what the health officer just mentioned, this 111 some pages plus, we have discussed our meeting, Lansing meeting. We are one of the recipients of I have nothing to do with it, highest GPA, my lack of words. So you guys, we did a good job.
Yeah, so we're accredited with commendation, so that particular rating stands through cycle 8. What that means is that basically we didn't have any not mets. So,
And we participated.
and the extra the extra pieces.
Yes.
So accredited with commendation is where we want to remain, and certainly the
Still,
expectation that I have.
Good. Good. Yeah.
I know it's a lot.
It is a lot. It's a lot for one person to take in. But each one of these sections is a different administrator. Well, not every section is a different administrator. But I only have 2 of these sections that I have to be responsible for making sure. So the rest of that, you know, I have 20 pages out of the,
Those-
Yeah, but Bucky's got all of it.
yes, she does.
That is what, money and spend, 2 items.
I actually, no, that's not part of accreditation, other than in, powers and duties.
No, that's the annual audit. She gets an annual review. That's just how that works. Yeah.
More than one, because we get the program audits too.
That's right, there are
We
program
get
audits.
2 or 3 of them a year.
Any other comments, commissioners?
Do we need to,
It's really just for you to have an acquaintance with and know that it's here. But this is on the resources page now.
Yes, it is, on the
So,
Board of Health Resources
I'll
page.
show you that real quick, just to make sure we're on the same page. If you go to our website,
and I noticed we've updated some of the images there right at the beginning.
yeah, we're trying to make this more user-friendly. Had a lot of feedback that people really hated it. And so we are working to try and make it better. It certainly continues to be a work in progress. But if you go down, scroll down to the bottom, is it in resources?
Yep,
Board of Health Resources, and then, so there's the Guide to Public Health for Governing Entities. We've shared that with
Which
you
is-
before.
completely updated now from,
Oh, good.
the new one is out.
Good, that's good. Your meeting schedule, your bylaws, our mission and vision, strategic plan, the plan of organization. Okay, apparently it was March. I really wanted to put that into January, February. The org chart, our bylaws for AAA, code of ethics, and then Public Health 101 training, the finance training, and then the accreditation site reports are all there.
Just one more information for the commissioners. You guys probably already know. Not probably, you already know. At the meeting, when we discussed how unique our agency here, the AAA is, under the health.
Right, right, and I mentioned that last night. So there are only 2 health departments in Michigan where the AAA is under the umbrella of the health department. And that happened because of the breaking apart of Region 3 AAA. Branch in St. Joe came down here, Kalamazoo stayed in Kalamazoo, and then Barry Calhoun is Wellwise? No, that's Region 2.
No, that's the other board that I'm on.
Yeah,
Care,
what's,
Carewell
Carewell.
is Region 3B.
yeah,
So.
so.
Hillsville, Lenawee, and Jackson are what was Region 2 is now Wellwise Services.
I sat next to her yesterday at the HSN. So, yeah, so we are unique. And it's a good partnership because really what AAA does is public health type of work.
It's a great compliment, both ways.
Well,
So it's not a voting item, it's really just an awareness item, and it is available to you at any time.
Commissioner Baker, 111 pages, probably you're a businessman and you have a lot of work to do, but there are strengths and weaknesses. I think mostly strength for our agency here, combined agency. Well, that's what other people talked about, I heard, not from me. So I'm glad to be represented from here, south. So,
I'm sorry, but I have to say this, I think I'd much rather read insurance contract language than this.
Well, then I'm glad that you prefer that.
I'm really not sure which one to be on.
God willing, he will be getting that
everybody else
opportunity
here.
11 o'clock.
Yeah.
That is why you pay us.
It is pretty dry reading. You know, one of the things that happened during the pandemic is we lost a lot of staff, right? You know, and we just had another couple retirements this month. So this is difficult stuff, you know, people that are new in these roles. We often say here at the health department, you don't really completely understand your role until you're about year 3. Year 3, you finally figure it out. That's a long time to still be like figuring things out and learning and understanding. But it really is the reality. So being ready for an accreditation visit, especially when you don't really understand the work that somebody did prior to you, can be quite difficult. So we're glad that you're proud of us, and we want to keep it that way.
Commissioners, take a motion, and if you want to include thanking the Michigan Local Public Health Accreditation Program, thanking for their work too, if you want to include in your motion, then they will be happy to, regardless of what you feel about it. And I can channel that to them next month's meeting, or not next month, next meeting. Accreditation.
He's gonna say something.
I'm okay. We'll let you make that motion on
All right.
tomorrow morning at our full board meeting.
Thank you. Do we have to recommend though? No. Oh,
Not in this
yeah, I'll be
case, it's
happy.
really an awareness
Tomorrow we have a
piece.
meeting?
Yeah.
Okay,
2 days in a row.
thank you.
I'm
I have-
aware, I'm well aware.
Yeah, I have 2 area agents and aging meetings tomorrow.
Oh boy.
I'm concerned about Commissioner Baker and our good friend here. Both are good friends. I'm saying because they are business, we want to be concerned about your time. All right, may I proceed?
For sure.
Next is Community Health Need Assessment and Improvement Plan. I'm going to request again the Health Agency Officer, Ms. Burns.
Yeah, thank you. So we, as you recall, hired a consultant to help us work through a community health needs assessment and community health improvement plan. And so again, I've pulled it up on the screen. This is available on the web for anyone to take a look at. There's a lot of pages here, as we've talked already. Community health needs assessment is an assessment to look at where we should be spending our resources. So it's best practice to do a health needs assessment on a routine basis to reevaluate the population that you serve, to make sure that you are using those scarce resources in the best manner. So we actually hadn't done a community health needs assessment of our own. We have tagged along, so to speak, to the hospital CHNAs. But this was just one that we did, using the talents of Marcus Cheatham as our contractor. So that health needs assessment is available here on this page. And you'll see that there is information for each county, including the health improvement plan, and then focus group reports. So there's a lot of information here that we're just going to just kind of touch on. There is also a video presentation that Marcus put together of his initial presentation that I'll just start. We won't let it run.
Hi, I'm Marcus Cheatham. I'm a retired local health official from Michigan, and I'm rehearsing a presentation for the Hillsdale County Human Services Network, which I will be presenting later this month.
So really all of the presentations ended up being very much like this, but Marcus did video that first one and then put it out here on this page that you can take a look at it. If you wish to review this video presentation, you're gonna see mostly Hillsdale data on this particular one, but you can find the data for the other 2 counties here on the page. So
What page is that on?
it's a tiny URL.
I actually did not include it in the information, but I will update that in the full board packet that goes out. I'll
Well,
update that page
I mean,
to make that
okay,
link.
cause it's here and I can get to those links, but
Right,
is that on our website?
it is not.
But we'll get it there.
Okay, and look in the resource tab as well.
I can do that.
Yep, so, I'm gonna flip to, is this what I think it is? Find out here in a second. Yep, so this is the actual community health improvement plan. And it's long and wordy, of course. Some of, the things that came out of this, our biggest concern is chronic disease. Did you get that, or are you still doing it?
I was gonna say, I'm gonna email it to Brent right now.
Okay. Chronic disease was the most concerning in the 3-county area. So heart disease, diabetes, those types of chronic diseases were the #1 killer. You done? Because I want to grab that back. Then what followed from that were focus areas that included mental and child health, mental health, and advocacy. The reason that even though our #1 killer is chronic disease, that we didn't end up having strategies with that, is that we have been working on those for years. And it's not that we should give up, and we're not giving up, but it's that they're very difficult to move the marker on. And when we're looking at where can we spend our time and get the biggest bang for our buck, it's not necessarily in chronic disease. So our community health improvement plan focuses on those 3 other areas. So this page, what this identifies are those strategies that the focus groups came out with. It indicates how many times it was talked about, the source, and what the strategy is. Moving along. I wonder if I have, yeah. So this is, boy, it's really small. This is what I was just looking at that I was talking off of. So our priority area for maternal and child health, and we list the strategies and who's responsible and when we're gonna start checking in on it. So one of the things that came out on maternal and child health was that families want more things to do in the winter, more group type activities. Interestingly that this came out, but it was the most talked about item in the focus groups. So this is one of our strategies, is to increase awareness, perhaps better branding. It's not that these aren't already happening, it's that a lot of times people don't know about them, or their family circumstances don't allow them to participate in a particular event that's happening, right? We gotta go to grandma's house for something or whatever. But what the focus group participants told Marcus and Thomas was, keep giving us these activities, this is what we want. So this made it into our strategy list. Another piece for maternal and child health is to explore a doula program. So this is a program to support mothers and reduce risk factors. We don't have a strong doula program in our Tri-County area. what we would do to tackle this particular item is to explore possibilities. There's a state initiative around doula. MDHHS has a state initiative around this. So what we would need to do is look at that state initiative, learn about billing for these types of services, and identify already registered doulas in our area to make sure that mothers know that these women or men are available to them. And then the final topic there for strategy 3 for this section is to try to identify pregnancies early and conduct outreach to enroll mothers in care. One of the things where we fall short in the 3-county area is prenatal care, getting moms into prenatal care on time. There is a lot of thought that part of that is because some of these mothers are getting that care in Indiana and Ohio. And so we just don't know about it. So it's not that they're not getting care, it's that they're not getting care in Michigan, and then consequently we don't know about it. That does impact our hospitals when we have low rates of prenatal care. So we are gonna try and see if we can't encourage our state partners to get this information on how many of our women are going south of the border to get care.
I'm sure the Amish community affects that pretty hard too.
I'm sure it does as well, because they don't necessarily get care, right?
Right.
They get care from their own community.
They have lots of kids.
They have lots of kids, yes, they do. And they, they give birth at home and.
Right.
Yeah. So those are the 3 strategies that were put together for maternal and child health. The next section is mental health. So, no, we are not a mental health provider here at the health department, but we certainly help to support and collaborate with our community mental health providers. So what came out as our strategies here, publicize availability of treatment for any insurance. So helping to publicize that our mental health providers, and maybe you don't know this, it used to be that our community mental health only served Medicaid clients. That is no longer the case.
Well,
They're supposed to serve everyone, regardless of insurance now. So that is a new designation for these 3 mental health providers in the 3-county area. We'll just leave it at that. So exploring visibility or viability of expanded medication-assisted treatment. So we know that there are individuals that are addicted. Some may be seeking ways to get away from that addiction, and there's good scientific research to show that medication-assisted treatment can be a positive way to get people out of addiction. But our Tri-County rural area lacks the availability of some of these MAT programs. So exploring what's available and trying to identify providers who might provide this type of service, and then potential resources to make MAT programs viable is one of the strategies.
Can you click on that little plus at the bottom and make that just a tiny bit bigger, please?
Yes,
Just a little, yes, thank
I have
you,
a question.
yes.
thank you.
Can we incorporate that with the AAA? Because we have, I forget the percentage of the 3-county area seniors, and also next door office, I'm the liaison for them. We can incorporate with I know they have services at the veterans, but something to add it to our agency, working with them, all these 3 or 4 areas you mentioned.
Pretty much every strategy on here is gonna require us to collaborate with veterans, with AAA, with the other service providers in our communities. So I would say absolutely, we will be collaborating.
And resources are available for both parties in the state plus the federal. So,
And that's part of Public Health 3.0, Chief Health Strategist.
Yep. The vision of 3.0 is that the health department takes the lead in helping to move that needle. So the final strategy for this section has to do with safe syringe programs. So this can be a controversial program. It includes the opportunity for individuals to exchange a used needle for a clean needle.
Promoting drug use.
And that is exactly the thought process that I expect is in our 3-county area. There is research to show that that really doesn't promote drug use. But what it does do is prevent other communicable diseases spreading, so hepatitis, HIV, things like that. I expect this will be a very, very big lift to get this in place in this rural 3-county area because of what you said.
Well, I mean, we're spending our tax dollars for people to do something that's illegal. I mean,
it will be,
I mean, heck, go to TSC, you can get a needle and syringe for
right.
$1.
I'm not a big fan of it. I mean, I know what you're saying and I know what you're getting at, but we're spending our tax dollars for someone to do something illegal.
and
But when you don't spend those dollars to prevent them from doing something legal, you're spending $2 to track down and manage the disease that's created.
I understand that, but we're still.
but it will be very controversial, like the one or 2 years ago, we wanted a family program, we didn't pursue.
Family planning.
Yeah, that same situation, I don't think anybody will, I'm talking about the citizens. I am neutral, but people won't buy it. We will have a big line here and he will be busy monitoring the cameras.
For sure.
Yeah, so there's good research and data to show that this is a good program, that it does, as Teresa indicated, at the end of the day, save us resources. But somehow we have to provide that information that we know that shows that, and then basically bring that along. So it has been done around the state, even in conservative areas like this, but we've got a lot of work to do to convince you that it's a good program and where money should be spent, so.
And we have to do a lot of work to find out what
Yeah.
the program would cost
Yeah.
and that we could even afford it.
Yeah, it is scientific, maybe commissioners may agree, but the other side, it will be very controversial. We are elected officials, remember that?
Oh, yeah, I know.
Remember
I know. I would share with you though that Pines, there are folks that work at Pines here in Branch County who have reached out in the past few weeks because they want us to start this SSP, or they want to be part of starting an SSP program. And I have said to Kaylee, we can certainly start, we can have a meeting with them, we can have some conversations, but bless their hearts, they don't understand all the complexity of starting such a program.
If they want to do it,
Right.
plus them.
Right.
But also, these aren't recommendations from the health department. It came out of a community health needs assessment that was community members.
That is true, and it's very likely that the reason that the SSP is on here is because when we were having focus groups with our mental health friends, it came out, and probably why they're reaching out as well, is actually what I believe probably happened there.
I mean, I don't want to go into the administrative area, but three county we have, and how are we going to put the dispensers where that become a problem.
Right.
You cannot put it in the downtown because people upstairs living apartment, they say, we don't want that.
Sure. I'm not exactly sure where it would be, to be honest with you, and I don't know what the cost would be. And, you know, we don't exactly have extra funds rolling around, here, you know, we spend every dollar, or at least we budget to spend every dollar, so, there would be a lot of work, and there will be a lot of work involved in that, and it may come to nothing. But it is, one of the strategies that came out of all the work that was done.
Well, yeah, and looking at this stuff, Rebecca, you know, you indicated that the two largest killers are those, really those chronic diseases, you know, heart disease, diabetes. But I think long-term, you focus on these two areas, you potentially take care of a lot of those long-term chronic illnesses and diseases. Kids start out healthier, they're gonna potentially stay healthier the rest of their life, reduce that diabetes, option, you know, possibilities, heart disease issues. You help take care of somebody's mental health, reduce that stress level, you help potentially reduce that heart disease, you know, issues and stuff, so yeah.
Again, I'm not, you know, that's one of the reasons that we work so hard here to make sure people have health insurance, right? I mean, that's why we have people who can help with My Bridges and get people signed up for Medicaid. Because it's routine healthcare that identifies issues, that gets people into treatment to prevent long-term. So we, you know, we already are doing that work.
A lot of this work, I mean, if we look at the stats that we pulled up here, what, 2-3 weeks ago? A lot of the work is self-preventable. If you wanna get rid of the long-term diseases, where was our obesity rate?
Oh, yeah, it's huge.
Right,
It's
I mean,
huge. Yeah. It's huge, and, you know, yeah. All right, one more area that was focused on is advocacy. And so this is really taking opportunities to meet with legislators, to talk about, priorities in our communities, and to, encourage them to pass legislation to make these things happen. So, that's really, I guess, all I would say about that. And those were, there's additional space here where we can add more. So Marcus has presented the Community Health Improvement Plan in St. Joseph County at the Human Service Commission, and then yesterday at the Human Service Network in Hillsdale. The BCCN, Branch County Collaborative, meets today here in this room at 10 o'clock or 10:30, and they will have the presentation today. There were some individuals who brought up, well, what you didn't touch on here is access to transportation and senior health. Those came up in St. Joseph County as areas that were really not addressed here. That doesn't mean that we can't continue to look at health improvement strategies and add them to our additional list of strategies here. Senior health, the reason it didn't come out is because the way we started with our community health needs assessment was with an invitation to all partners to participate in focus groups and let us know if you want to be part of the process, and let us know what you want to work on. And we didn't have anybody come forward that wanted to really work on senior health. That doesn't mean that they're not already working on it, but we didn't have a direct service provider come to us after we had those initial meetings and say, this is something we need to be working on. The same with transportation. So these are just as important. They may well need to be something that we consider and gets added to our strategy list. So, you know, transportation in Hillsdale County comes up all the time. You know, the fact that there isn't a transportation program for the county. I'm sure
We're
you
lucky
guys
we've
talk
got a
about
great
it too.
one.
Pardon me, you don't have one? We have a bad here, Branch County Transportation.
We have horse and buggies.
Well, we do have that, but privately owned.
Well-
It's hay cheaper per gas per mile, I don't know.
Not necessarily right now.
Not a drought.
So there are,
Yeah.
there are initiatives, in all three counties, but, and I think I put this in my board report for tomorrow. You know, the hospital in Hillsdale is interested in, coming to an agreement to borrow, rent, whatever, our van, a couple, 2 to 4 times a month, so that they can utilize that to go to areas like Waldron, or Litchfield, or Somerset, you know, remote areas of our county that don't have a clinical presence. They really feel that maybe they can make a difference if they can get out to those communities and provide clinical opportunities for residents that live there that can't access transportation. So, you know, some of these things we already are working on, right? And we continue to work on, but
I don't want to change the subject, but of course they can reimburse the, some money for utilizing the van.
oh, absolutely, we're not gonna do it for free.
I just want to make sure.
Great idea, though.
Actually, we still don't have a nurse to staff
We
that.
do have a nurse.
No.
When does she start?
3rd of July.
Started the day before
No,
holiday.
no, the 3rd of July.
Our holiday's the 4th, so we have a work day on the 3rd. I know, it's just the way it worked.
Too many people are gonna show up. Man, I don't feel good.
I had a little too much partying on the lake last night.
Any other
Yeah.
comments in that area?
No, so again, this is really, this is an awareness, topic. We wanted to let you know that it's complete at this point, where it's at, how to access it.
It is available on the Board of Health Resources page now, I added it.
Do we need to accept this, or?
You
I don't really
can,
think so, do we?
I mean, the contractor's done at this point, so,
I mean, right, we contracted with him to do it, so will
we
he be,
certainly can't accept
will he be
it.
presenting to the to the Board of Health or not?
His wife has surgery tomorrow, so, or actually today, so he's not gonna be available tomorrow.
But that 4 or 5 points, excellent, very good.
We won't be able to do much with all of the strategies that are on there, but my hope is that we can, you know, identify a few strategies that we can, you know, actually work on and make progress towards.
Well, thank you so much for that. If I may continue, next is a public comment.
Oh, yeah.
Anybody there? Anybody on the line? Nobody likes
The
us.
next one's my favorite.
Move to adjourn.
Second.
We have a motion to adjourn and seconded by our Commissioner from the West, Mr. Baker. Thank you, Mr. Chairman and Commissioner Baker, for that. Those in favor, please say aye.
Aye.
Those opposed say no. The ayes.
Aye.
Aye, aye.
Sorry.
Thank you. The
Making
ayes have it.
business.
We are adjourned.